So before we get into all of that and your career journey, I'd love to ask, what does public health mean to you?
Public health is everything, right? I'm sure we all learned that in school, but public health is everything. It's understanding that our health is not just about us as individuals. It's about the collective and what we invest in collectively. And that was a big shift for me. Like many public health folks, I wanted to be a doctor and have much respect for them. But I realized going into school for public health, there's so much that ties us together and determines our health. And that's what public health is about.
Absolutely. And you got your bachelor's in science in public health at the University of Arizona. I believe you were an intern at SSA before going into your bachelor's degree. So maybe tell us about that experience as an intern at SSA. Tell us what SSA is, and then about that thought process. Did you know about public health? How did you come across the bachelor's of public health?
Yeah, so SSA was and maybe it still exists, but a small firm that was actually treatment for sex offenders, which was my plan had been to go into psychology. And so it was an opportunity to work with therapists in an office and understand their work. As you can imagine, it was very hard work, and there were a lot of difficulties with it. It wouldn't be my career choice, but I feel like it really challenged me again in that like understanding and being curious about where people come from. So then that was actually in Portland. I had moved back to Portland temporarily and then moved back to Arizona and went to the University of Arizona. And I still was planning on being a therapist, and I'm terrible at math. Yeah, I was like, I'm going to take all these classes I had to take that were math classes, and I just couldn't pass them. And I was like, what am I going to do? I can't quit. So I found public health, which required fewer math classes. And then I got into it and I was like, oh, this is actually really cool. This is what I've been looking for. This is talking about things in the way that my brain thinks about them. And so after that, I was like, public health all the way.
Okay. And did you have any guidance in like finding public health, or was it just that you were like looking for alternatives that kind of were like sciencey, psychology, and then found public health?
I think I was like, what can I do that my credits will transfer? I was like junior year, like, what can I do where my credits will still count and it won't be a waste of money the last few years? And then I went to an info session and I was like, oh, this is actually really cool.
Well, thankfully you fell into public health. I'm glad that you made it here.
Me too. Yeah.
And while you were in your bachelor's, you had a research assistant position at Clinical Psychophysiology Lab and a health promotion intern at the Canyon Ranch Center for Prevention and Health Promotion. Can you tell us about those experiences?
Yeah. So my research experience was back when I was still in psych. I was still a psych major. And it was a fun, weird thing. It was like studying, brain activity. It was like a bunch of like undergrads, research assistants helping determine whether or not the PI wanted to actually move forward with this study. And so we were like literally the guinea pigs. So like we had the EEGs on. I would go home every day and have like this like gross like gel that you put on your hair. And I'd be on the bus and my hair would be all stuck up with like weird gel everywhere. And I'd go home and wash it out. But it was fun. I mean, we enjoyed it. I don't think it actually went into an official study. But I learned a lot about the study process. And I think just knowing not everything is going to work out is also good to know. And then when I started shifting into public health, I started working and focusing on health education, and particularly focusing on food access and educating about healthy foods. I'd grown up, my mom was a teen mom, and I'd been on free lunch program, been on SNAP. And I remember when I was like 17, I had a fresh green bean for the first time, and it was like life-changing to me. And so I wanted to bring those experiences to other people who had grown up similarly. So I did a lot of outreach and education about food as medicine in my internship at the Canyon Ranch Center.
That's awesome. And then, like, thinking about your entire experience in undergrad, as well as those two experiences, and I guess maybe the other things that weren't on your LinkedIn, were there any like huge undergrad takeaways that you wanted to share with us, or smaller undergrad takeaways? Doesn't have to be huge.
Yeah, I mean, I did so many community events, and I felt like that was really valuable and something that I ended up continuing as I left undergrad, like looking for those community opportunities because I just loved connecting with people and meeting people where they're at and not just focusing on like, brass tops kinds of things. So yeah, that was the most impactful to me, was just being able to connect with people from all over.